This is our second episode about Neffy. Our first one, we talked about the science and technology behind it and explored the trials they did to get Neffy approved. But today we're taking it a step further and we're diving into what Neffy really means for patients and healthcare providers. What does it mean for people with food allergies to have more than one epinephrine device? This podcast is made in partnership with the Allergy and Asthma Network, and we want to thank ARS Pharma for sponsoring today's episode. While they support the show, all opinions are our own, and sponsorship doesn't influence our content or editorial decisions. Any mentions of brands is for informational purposes only and not an endorsement.
You're listening to The Itch, a podcast exploring all things allergy, asthma, and immunology.
Have you guys heard about Neffy? Neffy is a needle-free option for epinephrine, and that is what we're talking about today. We have Dr. Burnette joining us to talk all about what this new nose spray is going to bring to the table for us folks with food allergies. So before we get into the whole Neffy spiel, Dr. Burnette, can you tell us a little bit about yourself?
Yes. Hi, Kortney. Hi, Payel, Dr. Gupta. My name is Burnette. I'm an allergy physician in the Washington, D.C. area. I'm an academic allergist, and I see patients who have asthma, who have food allergy, who have eczema, who have allergic rhinitis, who have many allergic conditions. I think this is a very relevant conversation today with my patients who suffer from food allergies.
Have you already had patients that are interested in getting Neffy? Have they come up to you asking for it, or have you not really seen that yet in your practice?
I haven't seen it yet. I think there was a slower rollout just because the approval by the FDA was unanticipated by a lot of patients. So I haven't had a lot of patients yet, but I am actually taking it upon myself to mention this option that is now FDA approved for patients to get access to.
This is one of two conversations that we're having about Neffy. The first conversation has really been about what is it? What's the research behind it? How do we know it works? However, I think we still want to define exactly what Neffy is on this episode for anyone who hasn't had time to listen to the previous episode. So Autumn, can you just tell us very briefly about what is Neffy and how is it going to help our food allergy patients?
Neffy is a novel way to deliver epinephrine through the nose. It was FDA approved August of 2024, and the device is a single dose of epinephrine in one nostril. It comes as a 2-pack, and there's a carrying case for this medication. It is novel in the sense that it is needle-free and easy to carry. It essentially delivers a single dose of epinephrine into the nasal passage to treat anaphylaxis. So it is a novel technology for patients who actually need and require epinephrine to be carried.
And is Neffy available for everyone? Because I'm thinking that parents are probably like, this is great. I can give my 2-year-old Neffy. Is that possible at this point?
Neffy is approved for adults and children as long as they are 66 pounds or 30 kilograms. So it is, yes, approved for adults and kids as long as they are a certain weight, which is 66 pounds.
So probably not a 2-year-old, but we're looking at more of a 10, 12-year-old that would probably meet that weight requirement. We talked about this in the previous episode that it is the first needle-free option. I think it's really exciting to have a needle-free option, especially for those patients that are needle phobic. And what do you think about the convenience of its use and the convenience that it might provide to patients?
Well, I think that was a big issue with delivering epinephrine. If it's cumbersome, if it's inconvenient to carry, a lot of patients were leaving it at home. And if they do have a fear of needles or they're just fearful of the pain of an injection, it possibly could have delayed the delivery of epinephrine for a lot of individuals. And I think, in my opinion, having a different delivery system, particularly that is needle-free, that can easily be carried, I think it's a game changer for a lot of patients who really do need to keep epinephrine with them at all times in case of the risk of having anaphylaxis. So we know food allergy is unpredictable. Even when you're doing your best to avoid the culprit food, you're following your doctor's orders, you're doing everything that you could possibly do. Accidents happen, things happen. And so the notion of being able to change the game, if you will, in terms of now being able to carry a device and not fear pain from that device or just having to use a needle, I think is a novel concept. The interesting thing as well is that because there's no needle, you can actually dispose of this in the household trash can. So you don't need a sharps container after you use this device. So there's so many different reasons I think that patients may be actually excited to have a new novel route, delivery, and way of thinking about delivering epinephrine.
Thank you. That was so helpful. And I think that it is smaller than a lot of the epinephrine devices. When you put them two together, then, it's a little package, but it's definitely smaller and potentially easier to carry than the other epinephrine devices. So that's nice. But I do still think that people are skeptic. So, Kortney, can you talk about some of the things that you've seen in some of the blogs or some of the commentary from the food allergy community?
Yeah, definitely. I think the big difference is really that when you use an auto injector, you're actually physically putting something into your body. So you feel like, okay, that medicine is delivered. And I think that's actually one of the biggest barriers, right, of getting people to use it is because it feels invasive, which it is, it's a needle. But when you have a nose spray, all of a sudden you're concerned that you're not going to get all of it into you. You're not sure if it's going to leak out of your nose. You're not sure if it's going to work, if you're congested. And so people are just really concerned that you're not going to get the full dose and it's not going to do the job.
One thing that patients probably might find helpful is that Neffy.com actually gives some information available for patients, available for providers to actually just take a look at the design. I think that's a novel concept. The handling of that device, I think, is very novel. Epinephrine through the Neffy device is actually designed to be rapidly absorbed into the nasal passages to reverse anaphylactic reactions. What's also interesting is Neffy device uses what they call intravale technology, which temporarily loosens the space between the nasal cells to help that epinephrine to be absorbed into the body. And the typical feeling that you would feel when you're delivering epinephrine through a needle are still the same typical feelings that someone would feel when they're delivering Neffy through the nasal passage, which is you get kind of nervous, you get anxious, you get jittery. Those things happen just as they would if you were delivering epinephrine through a needle device. So you would know that it's on board because you're going to feel those same feelings fairly quickly like you would if you're delivering epinephrine through a needle device. But that technology, that intravale technology, is actually one of the key reasons why it does get into the nasal mucosa and it is rapidly absorbed. And then the positioning, you don't really have to worry about positioning. You can deliver Neffy nasal epinephrine sitting, standing, laying on your side, upside down, that the positioning of the body does not matter. And it's also not contingent upon the patient having to sniff or inhale. There's a 1, 2, 3, 4-step process that's actually delineated in the actual carrying case. One side of the carrying case are the 2 nasal spray devices because you have 2 just in case one is ineffective. You can use the second one 5 minutes later. So I think they just made it really easy to not only carry easily on your person in your top pocket or your back pocket, but they've also just made it user-friendly in terms of there's a 1, 2, 3, 4-step guide. I think it's fairly user-friendly for patients.
What's interesting about the nasal spray from a patient perspective is 2 things. Is I feel like parents might have more confidence that their children will use it. If they do feel like there is an allergic reaction coming on, they will feel more confident to use it because it's not putting a needle into yourself. And as a child, I think that's much easier to wrap your mind around. The other question I have is, do you think that people will overuse it because it's so much easier?
I wouldn't technically go that far. Just generally speaking, the whole notion of using epinephrine when it's supposed to be used, I think has been the main issue thus far. People, generally speaking, delay delivering epinephrine. And they've delayed it because it was inconvenient or because they feared needles or because they wanted to wait it out. And really, when we're talking about food allergy and anaphylaxis type of education, we really should be emphasizing the notion of understanding what anaphylaxis is and understanding that the first line of treatment for anaphylaxis is actually to administer epinephrine. I am not fearful that patients will overuse this. I'm excited at the notion that they will not delay. It gives us now the opportunity to talk about anaphylaxis education and what the first line treatment of anaphylaxis is, which technically is epinephrine, and being more conscientious about really taking those necessary steps to carry that device with us, I think is really going to be the forefront of the conversation going forward.
We've talked about this in previous episodes, but our main thing that we always want to emphasize to patients is that epinephrine is a safe medication. So it's nothing to be feared. And I think that because it was a needle device, it felt like it was a big deal to inject yourself or inject your child with a needle. And so I do think that people are going to have that ease with knowing that if they are prescribed Neffy, that this is not a needle medication and that might ease some of that fear from epinephrine that we've always tried to ease a little bit with our patients. But I think this will help. What do you think, Autumn?
I definitely agree. The notion now that there's ease of carrying this device, there is ease of delivery of this device, because with anaphylaxis, not only is there a burden of having anaphylaxis, a burden of the condition, the manifestation of the symptoms, there's a burden in and of itself within that. It's a scary thing for patients to experience anaphylaxis, but there was the burden of treatment when you're talking about a needle. And so I think now this is a game changer for a lot of patients who just were reluctant to do the right thing, follow the necessary steps, and administer epinephrine in a timely fashion, because we know that the most unfortunate consequences can actually happen when epinephrine is delayed. So this gives us a way to think about the delivery of epinephrine so that there is less of a delay.
Yeah. And I think also bystanders, when you're having an anaphylactic reaction and you need someone to help and to administer because the person who's having the anaphylactic reaction cannot give themselves their epinephrine. And so this might also help with that, where other bystanders may be more comfortable and feel less scared to give something like the Neffy versus giving something that's injectable. But I know that we're saying lots of positive things, but I do think that it's not going to be for everybody. There is weight restriction, so we know that that's there.
I think it'll take a long time for people to trust it, honestly. Like, I'm a kid from the 90s, and my gut instinct is to reach for a bottle of Benadryl and not my epinephrine auto-injector, because that is what I was told when I was younger, and that's what I did. So it takes a long time for us to trust another medication. You all kind of just want to wait and see it work with someone else, you know? I mean, I don't know if a lot of allergy people are early adopters when it comes to epinephrine tech.
I think with any new drug, I think there's going to be a process, if you will, in terms of the educational component, revisiting what is anaphylaxis, helping us to understand the need for epinephrine and how that treats anaphylaxis. I think this is now our initiative to push ourselves to learn more, in my opinion, to think in a way that now that a lot of the barrier is removed from having the fear of the needle or giving an injection, now how do we really think about managing anaphylaxis? I think this is now a part of the conversation. Let's really focus on treating anaphylaxis, treating it early, making sure that patients understand what the anaphylactic symptoms are, the importance of that treatment in terms of managing anaphylaxis in a timely fashion. I think is going to be really key at this point.
So, is there anyone that Neffy isn't good for? And I'm saying this to a friend who had a nose job, and we've read that that's probably not going to be an option for her. Is that possible? And are there people who should just stick to having an auto injector?
Well, I hear your point. If there is a obvious block or obstruction that is impeding the actual insertion of the device into the nostril, yes, that would probably be something that would be an impediment. Now, granted, that may just be unilateral. It may not be both nostrils that have an impediment. So if one nostril is fully blocked or obstructed and you can't actually insert the device, then potentially you could use the other nostril. So that's just something to keep in mind. But again, even if a patient has nasal congestion, it actually may enhance the absorption of the epinephrine into the nose. So nasal congestion would not impede it. It would be more of a physical blockage of that nostril, if that makes any sense, an anatomical physical blockage of that nostril.
Snotty, crusty nose is not necessarily an impediment for Neffy then. I think that's what we all think about, is like really crusty kid noses, and it just being like, nope, not going to work.
To be frankly honest, even the data and the studies have shown that having nasal congestion actually improved the absorption to a higher degree actually than in injectable epinephrine. So the notion that it would impede epinephrine working, I think it has not been shown. It was actually the opposite in the clinical trials.
Kortney and I have had several episodes just recently about just insurance and access to medications. And so how do you think the access will be to a medication like Neffy?
Well, I think ARS, which is the company that makes Neffy, I think they took it upon themselves early on to try to do that very thing, which is make sure that patients can afford to get this medication. There is a copay assistance coupon that can be used for most eligible commercially insured patients. So I think that's one thing. They wanted to try to get that value down with that copay assistance card to about $25 for those who are commercially insured. Now, everyone may not have commercial insurance, right? So there is another offer, and I think GoodRx may offer this as well. And also the company can help with this cost as well for those who do not have any insurance. And I think the cost of the Neffy medication would be approximately $199 for those patients who are either have no insurance at all or who have maybe a higher copay. The goal is to get that cost to approximately $199. And I think even GoodRx has something in terms of a coupon that patients can use to get their Neffy device. The other thing is that for patients who are still having difficulty getting their medication, there is a patient assistance program. That's another route that one can take to hopefully get that cost down to even less than that, and maybe even for $0. So they're all different routes and avenues that I think the company wanted to provide for patients so that they can actually access this for a low cost.
And if you're looking to get the medication, and I just need to double check because in Canada, you can get an auto injector without a prescription. I don't know if you know that, but you can. And so I just want to make sure, because I know that most of our audience is US based, but this is something that you go to your doctor and you ask for a prescription for.
That is correct. So they do need a prescription from their physician, their healthcare provider. Yes.
Great. And then they can start the conversation there and make sure that both of their nostrils are open. They don't have a surprise deviated septum.
So, yes, I mean, I don't want anyone to think that just because they had maybe sinus surgery or anything like that, that would be an impediment, though. It's really just if there is an impediment to actually insertion of the actual device into a nostril. So that would really be the impediment. It's anatomically blocked where you can't actually insert the device, but that would really be the only issue I think that a patient could have in terms of not being able to use this.
And that's super rare. I don't think that we encounter that often.
And can someone have a nose ring?
So yeah, there would have to be a full out blockage where you could not physically insert that device. But I don't think a nose ring would count as an obstruction in that way. I think you could move past that ring very easily and still insert the device because the device is small enough, by the way, to fit in a smaller nostril too. So I think it's for at least the parents who may be administering this to their child who is at least 66 pounds or 30 kilograms, they would still essentially be able to use this in their child's nose. So nose rings shouldn't be an issue.
Super.
There was one other thing I wanted to mention, and that is the fact that Neffy is a longer shelf life. And I think it's typically with an injectable epinephrine, the shelf life is anywhere typically from 12 months to 18 months. The shelf life for Neffy is actually 30 months. If you're thinking about cost, if you're thinking about how long the medication will last on your shelf, it could be a game changer in that sense that it lasts a longer time, at least twice as long as injectable epinephrine in terms of its shelf life. So if you're thinking about cost savings, that is one arena that you could go in terms of cost savings.
Sorry, one more question. Do you know if it's heat sensitive as well, like the auto injectors are?
It should not be frozen, put in the freezer, and it should not be stored at super high temperatures for more than a couple of days. Typically, it is stored at room temperature in order to maintain the integrity of the medication. So that's just something to keep in mind.
So should we wrap this up with just some final thoughts?
So I think it's giving all the options that are available to every single patient and then using shared decision making and making those decisions together. But I think the key take home is that All of these devices do work. They were properly tested, and we feel confident that if somebody's in a situation where they're having an anaphylactic reaction, that all of these options would be safe and would help them stop that anaphylactic reaction from happening. Any other parting thoughts for our audience, Autumn?
I think it's always a great idea to have multiple options when we are trying to address anaphylaxis or any other condition that can potentially be very debilitating and potentially even scary for patients. I think it's a nice notion to have an option that is needle-free and that's convenient and that may be less cumbersome for patients to think about when they really need to address what's happening to them in the acute moment of having a severe allergic reaction. So I'm happy that this is now a part of our treatment armamentarium. I'm interested to see how patients feel about this going forward.
Yeah, thank you so much. I'm very excited to see and get my first Neffy device eventually. So thank you so much.
Thank you, Autumn. We appreciate you taking your time out of your busy schedule to be with us.
So great to be with you guys today, and this is exciting.
Thank you for listening to today's episode. Remember that all information you hear today is for informational purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. And also, don't forget to subscribe to our podcast. And if you have a second, help spread the word by rating our podcast and sharing with your friends and family who might also be interested in learning more about allergies, asthma, and immunology. You can always stay up to date by checking out our Instagram, The Itch Podcast, where you can leave questions you are itching to know, or check out our website, which is www.itchpodcast.com, which contains more information about the subjects we covered in today's episode and every episode. Until next time, have a fabulous week.